Good evening. I'm Dr. Frida Wadley, Talbot County Health Officer. This is the 22nd day of the activation of the Emergency Operations Center. It's been a tough week. We've seen the cases across Maryland climb. Today we had 2,758 cases. 7 of those cases were in Talbot County. What I want to emphasize is, although this infection can be very severe in seniors, we want to continuously remind you that younger people are getting the virus. Some of them with chronic conditions are having a very severe infection, and some of them are dying. So it's all ages that we're concerned about, and all ages can be infected. This week there's been other questions, and one of those has been about potentially asking everyone to wear a mask. And now they're asking, well, why are you doing that now when you've never advised that before? So here's the reason. In the beginning, we always said that the mask protects others better than the wearer, and that's still the case. So if you had symptoms and you had a mask on, when you breathed out, that mask would trap those moisture particles that has the virus. So you'd be protecting others. So we call this a new virus or a novel virus. So we're learning something new every day. And one of the things that we have learned is that, yes, people when they're symptomatic of COVID-19 are very contagious. But unfortunately, a day or two before they become symptomatic, they may be able to shed the virus and infect others. So now they're saying that since the virus is so widespread, maybe we all wear a mask to help protect the others. But let me warn you about one thing, okay? You don't wear the mask and ignore everything else. You wear it in addition to social distancing, washing your hands, disinfecting surfaces. That all still is important. And you have to recognize that don't get a sense of security just from that mask. But secondly, we're really low on protective equipment for even health workers. So it's not like we can provide surgical masks for everybody to wear and a new one every day. This is where you use the homemade mask. Many of the quilters and all in Talbot County have been making these, but if you don't have one of those, you can actually wear a handkerchief, a bandana over your mouth and nose. And remember, you have to wash that every night too. You don't wear it forever, but wash it every night. I've also gotten some questions about why does a state map that shows the county and the numbers that are positive, why is that different sometimes from what's given out in our press releases? People at the state are working very hard trying to keep up, but I can tell you the rates that you see in our press releases every day and also on Talbot COVID-19, those are the actual cases. We have 7 cases. So we urge you to go to that website. Not only does it keep up with the cases, but it gives you some very important information. And then I think everybody always wants to know, so what can we be doing? Number 1, if you have any symptoms of COVID-19, fever, cough, sore throat, congestion, it may not be COVID-19, but if you have those, stay at home. Call your health provider. Do not get around other people that you can infect. Number 2, the social distancing and the hand washing are the 2 proven things that we know work in slowing down this virus. And then the last thing, you just got to keep the faith. We'll get through this, but we'll get through it a whole lot better if we're working together.